Hi there. Welcome back to our LinkedIn Live summer series called Self Care in Healthcare. Today, I am very excited to welcome our special guest, Dr. James Marzolf. James, thank you for being here.
Thank you for the opportunity.
So, in this summer series and in this newsletter, we're really talking about and discussing resources and giving healthcare professionals inspiration for both personal and professional development practices, especially those rooted in holistic health. And one of my beliefs is that healthcare starts changing and evolving by focusing on the health and healing of a healthcare professional. So I want to know, in your experience, what does the word healing mean to you?
Wow, you start off with the big questions, don't you? Well, I think that health in particular is a very sort of interesting issue. I don't think that anyone really is ever 100% healthy. There's always one more level that they can add on it, and on the other hand, if they're like completely sick, then probably we may be looking at their demise, in which case it's no longer relevant. We operate between those two extremes. So I think that, there's always going to be a need for, regular allopathic medicine, medications, and so on when people's health gets so out of whack that they actually need some help. But I think we are arrogating too much to ourselves and we think that we heal anybody. The body and the person, they heal themselves. We can help, but they have to have that innate capacity to actually sort of recover and get back into some sort of equilibrium. And we also know that, probably healthcare is only about 20% of what determines your health status. And there's many, many other things. Um, Amongst them, of course, are nutrition and activity and bad habits or good habits and all that sort of thing. But there's also, I think, a need to really re-examine it from the perspective that even if we have these sorts of advanced systems, they're not always the best approaches. And there's so many other approaches that have developed worldwide over thousands of years and somehow have persisted, which means that there's usually some basis and efficacy in them to be pursued. And we can look at that in kind of a double spectrum. One is just as when there's an acute illness, you may want to prescribe an antibiotic or something of that nature. Or maybe the person's in severe pain and you might you could use analgesics or maybe use acupuncture. But we're not trying to get them sort of turn them from one addiction into another and become an acupuncture junkie. That should be looked at as a bridging sort of therapy that leads them into some sort of efficacious self-care. And this is an example I think of is Tai Chi. Many spine surgeons are now using this as an adjunct to physical therapy because it's something that the patient can continue to use even when they're declared well and released from care. And so it helps them develop a lifestyle that will maximize their chances of being healthy. Yoga is another example, therapeutic yoga. It's something that they can take from the clinical phase, they can take it back home with them and do it there and continue to have those benefits. I mean, the famous running doctor, Dr. Ken Cooper, once said, he goes, primary care is a misnomer. It's really secondary care because the people are already there and they're already sick. So the goal should be to keep you healthy and not provide a bunch of care, much too much care too late.
Absolutely. And I think, a couple of things you said there. One, having a more proactive approach than reactive approach. So background in, for me in pharmacy, really seeing people who are put on medications like a proton pump inhibitor, for example, with no duration of therapy noted, get left on it for decades.
Yeah.
And there's never, a question of what does that patient need to help get them back into equilibrium. To your point, the body has this intelligent design to where it knows how to heal itself. And so sometimes in healthcare, it's just removing the inflammatory triggers or the stress or emotional triggers that are manifesting as physical symptoms. So I think that's an important piece to note. What does that equilibrium look like, and how do you see, I know you have a background in healthcare reform and really looking at how can we put financial incentives in place to keep people healthier from a preventative medicine standpoint. How do you see that conversation shifting the way patients are approached, either in primary care or in, say, a community pharmacy setting?
Another big question. You're very good at that. I would preface that by saying is that um, all sorts of therapies and wellness activities and so forth can persist, but unless there's a financial incentive, you're always like sort of paddling upstream. And it isn't a new thing. I mean, if you look even back through time, in ancient China, there was a payment arrangement with physicians in which you paid them so much money every month till you got sick. Then you paid them nothing until you were well again.
Wow.
Yeah. So, fast forward to, the current, era. And we had, of course, the whole, development of HMOs in the 70s and 80s. Then it sort of went, sort of under the surface, reemerged again, relabeled as value-based payment systems. But the idea is to get out of the fee-for-service area where, I mean, in fee-for-service, essentially, you make the greatest profit if they're sick, never get well, have multiple diseases, and preferably die a slow and lingering death. That's your maximum profit model. Well, the antithesis of that is that if you can do things to encourage them to, better lifestyles, self-care activities, or even, sort of other less, sort of intrusive treatment modalities, then they can preserve their health. They don't need emergency room visits. They don't need the surgery. They don't need as much inpatient care. If you're making profits doing that, then I would say those are profits well earned. You're doing the right thing. And that's very consistent, with the Hippocratic oath that all of us took as physicians. But then you go into the real world of Western allopathic medicine, and it caused a lot of cognitive dissonance, which I think has actually contributed a lot to physician illness, burnout, and all that sorts of
Yes.
stuff. So if you can align the financial incentives with the moral and ethical pathway, so much the better. Everybody benefits.
Absolutely. So I I think part of what we're seeing with that, you mentioned cognitive dissonance, is professionals, they feel like we're being forced to practice in a certain way because of the way that reimbursements are structured, and because it is more profitable to have people on medications, or seeing people in the office multiple times per year or whatever. There really isn't a good financial incentive for prevention, which is, I think, all things being in a perfect world, that would be where most healthcare professionals would start. So how do you encourage healthcare professionals to, those that are experiencing burnout, those that are frustrated with the current healthcare system, how do you how do you encourage them to kind of be the change that they wish to see in healthcare?
That really strikes to the heart of the matter because um, if you look at physicians in general aren't really a healthy group of people. A lot of healthcare providers aren't. There are some exceptions, but most of them are all that healthy and so on. And I think that there's great virtue in sort of engaging them, because once they've experienced it themselves, once they have that tacit experience, well, it's just like they can hardly wait to tell the other person that, hey, this really worked for me. And I had a slide in one of my shows which showed a nurse, sort of hovering over an ICU patient. And she's saying, Joe, when you get out of here, I want you to go down and talk to that health coach and get in the yoga class. I know it's going to work for you because it worked for me. And I don't think that you can sell it better than that. So yeah, I think that, the quadruple aim, they call it, the fourth thing they added was the health of the professionals themselves. And that's key because they will be your marketing force. If they know it works, they will spread it. But in terms of the payment system, there's a caveat there. And that is, okay, well, if we prepay them and say, oh, well, we'll profit share, but also loss share. And now you got all the financial incentives, but the big incentive there is to give no care at all. That's maximum profit. So we have to avoid that. Plus, given the state and training of our workforce, if all you do is change the payment mechanism, all you're doing is transferring risk to the provider. No, we have to give them the resources and tools to engage patients on a different level, to introduce different kinds of practitioners or healers, if you call them like that. And for some of them, there's a big obstacle because there's no CPT codes. There's no, job taxonomy. There's all these sorts of things. So it makes it very difficult. But little by little, I see this edifice being chipped away. And I think that overall, this is going to be driven to a rapid conclusion by the current emerging economic conditions. We're basically in a place where dollar devaluation has lowered people's purchasing power. So now they're having more and more people having to decide between food and medicine. So, and similarly, the hospitals are being squeezed, the payers are being squeezed. This is the time that you have to come up with a new solution. The solution is self-care. Whatever works, introduce it, keep them out of the hospital. We'll always need hospitals. I mean, Johnny's going to break a leg, but they should be there for the appropriate thing, not for chronic lifestyle diseases. And to what really I found very fascinating when I first spoke with you is the role of pharmacists in this. Well, I think it's a huge role. If you look, in ancient times, they had, the barbers did the surgery, the apothecary gave out, sort of the remedies, and the doctor, which derives from the Greek doctros, to teach. He was supposed to teach people how to live healthier. Well, we got kind of past that, but I think that returning to those ideas are very important. We know, for instance, that I'll give you an example, and there's now quite a bit of literature on this, that people who had low levels of vitamin D had a much greater likelihood of hospitalization and severe consequences from COVID. And you say, ask yourself, well, okay, well, we don't really have the randomized controlled trials, but what do we know from what we've got? And they identified 3 groups as having a higher prevalence of vitamin D deficiency. They were the elderly, African Americans, and the Hispanics. Well, who had a higher hospitalization and death rate? They did. So would it hurt to increase their vitamin D levels? I don't think so. But I think that we need to expand the role of pharmacists into nutraceuticals and other sorts of things that they can really advise people on, so they don't say, okay, there's your prescription, go, but they say, you also might want to look at this and this, and here's also some interesting dietary steps that you could take that would help the medication that you've been given. And I think there's that's just an untapped field that could really move the dial on health status in our country, which is in trouble. We're now the fattest people on earth. Our lifespan's going down. So it's just a matter of pumping money into the system. We should be the healthiest people on earth, but we're not. So we have to do things differently. We have to try different innovative ways and make each contact with any kind of, healthcare provider or healer, make it really count. We're talking about transformation of social consciousness, so that the people of our country, the citizens, understand what role health plays in their life and why it's so important. And I'm an old guy, so I've seen a lot, And I always think of this one quote from Herophilus, the Greek philosopher, who said, when health is absent, wisdom cannot reveal itself, art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. And for me, that pretty well sums it up. It's key to
Abs-
everything. It's central to everything we do. And I think that given, the dire consequences of, economic slide that we're in, and just, the inherent broken system of healthcare we've got, now is the time. And it'll take all of us doing our best and really being flexible in terms of the approach to make a difference.
So that's what I want to ask you about is the approach. Just to play devil's advocate for a second, we're kind of conditioned in pharmacy school and medical school, whatever, to see a symptom, to diagnose, and to prescribe a treatment, to recommend something. So many times when I was practicing in the pharmacy, if someone came in and asked me for recommendation over the counter for constipation, my first question would be, what's your diet look like? How much water are you drinking per day? How much, how much movement are you getting? And what I've heard time and time again is people want easy. People want the magic pill. And I think as we've amassed more and more evidence of being able to use medications and use some of these pharmaceutical interventions on a longer term, it's not correlating with better health. So how I know we've talked about motivational interviewing, we've talked about focusing on the patient's goals, also focusing on our own health goals. What are some ways that you would recommend to approach a patient or even to start your own health journey so that you can begin thinking in terms of preserving what health you have and even increasing your health status without uh, without the use of anything, just allowing the healing to take place naturally. What type of approach would you recommend for healthcare professionals that are wanting to begin having more of these conversations around lifestyle interventions?
Right. Well, there's a plethora of opportunities, things like all the activities of the American College of Lifestyle Medicine. There's the Whole Health Institute. There's some very exciting, sort of recommendations coming out of the National Academy along these lines, whole person health. So it's not like it's a gold nugget that you have to go seek. It's just a matter of, the will to do that. And I'll tell you that one of the things that's going to drive it is that more and more providers are getting into these value-based systems where they actually have an incentive to keep people well. Well, generally what happens, because they're still doing what they were doing before, right? So you've transferred the risk. So for the first few years, it'll go well and everybody has some profits to share, and then it plateaus because they've stopped all the low value care. They've, sort of in an iterative process have refined their operations as far as you can, and there's no more to squeeze out. At that point, they ask themselves, what can we do to keep these people healthy and keep them from coming? That's the moment in which these things really become relevant because it's a matter of survival. So do we always want to wait to that point? No, but if you think about, sort of the whole emergence theory and paradigm shifts, what happens is, there's a critical mass that's attained. It's kind of slow up to that point, but people start networking and sharing ideas and sharing resources and finding things that work. At some point, you get to that critical mass, all of a sudden, bang, it's almost overnight. You've got a paradigm shift. At the end, they happen very quickly. And I think that we're witnessing that now, driven both by our own internal processes in the medical field and also by externalities like the economy and everything else. So
I love that. And I really am seeing that in pharmacy. More and more pharmacists are coming to me saying, "Hey, I'm really more interested in focusing on getting people off of their medicines. I kind of want to be the anti-drug pharmacist. How can we leverage things like Tai Chi and yoga and acupuncture and these modalities of healings that have evolved with us, really, as a species. We've been using them for hundreds of thousands of years. The question that, I think people are wondering, how do we get patients to buy into this idea of health and healing?
Yeah, the transformation of social consciousness.
Yes.
Well, again, it's a push-pull. One, is they can't afford it anymore. People are 40% of the people in the United States, there's evidence that they're postponing care due to, economic reasons. So they got to find something, that fits the bill. They have to. They have no alternative. And the second thing is, I think that people, are waking up to the fact that we're not a very healthy group, overall. And so there's got to be something better. So I have a thing of rule of thumb over the years. It's a 20-60-20 syndrome. You got 20% of the people that if they hear about something that'll improve their health, they're there. They're beating on the door to get in. The next 60%, you have to work increasingly harder to get that next percent. The last 20%, it's pretty much, they're not going to do it. So we start by worrying about the 80%, but I think that it even goes larger with that. And one of the things I wanted to mention was this idea I had that, okay, you got value-based payment for providers. What if there are these collaborative agreements also with pharmacy? That you're being capitated to manage, co-manage with the providers the health in a circumscribed population, and your profits derive from being the most effective way of doing it for the least money, and you make more profit. That would change the game quite a bit, I think.
Totally, totally. And yeah, absolutely. I think that pharmacists are very underutilized. So right now
I
we're
totally agree. Yeah.
we're we're seeing more of the emergence of pharmacy interventions in with I think pharmacists ended up giving about 80% of the COVID vaccinations and administering around 50% of the COVID screening tests. Just to use an example, but the impact on community and population health can be those conversations where you're focusing on lifestyle, you're focusing on movement, you're focusing on food, and you're helping the patient set realistic and obtainable goals. So one of my clients, he's doing a diabetes self-management training course, and he said the diabetic people that are signed up are really more interested in gaining energy, in feeling better. And so, really, it can be a conversation around health and wellness. It can be a conversation around vitality and energy and getting enough sleep and getting enough hydration. It doesn't have to be a super complicated protocol, right? It's just introducing these ideas as um, the instead of the first drug of choice, maybe it's the first intervention of choice for a particular symptom.
No, I totally agree. And one of the thoughts I had on underutilization of pharmacists in general is we have to take like payers, providers, and pharmacy and learn to work together in a new way, a new
Mhm.
way, a way that, basically everyone shares in the benefits if we all perform well. And I think that's one thing. The other thing is I think it needs to be generalized to, it's almost like we'll be fish in water. I'll give you an example is during the period of time I worked in the VA on whole health, there was one really innovative director of employee health in a hospital in Tennessee, I think. She had a meditation gong over the PA system sound 4 times a day, in which everyone would stop and take a mindful moment. Just a simple thing. But if you think about it, is you can close your eyes and not see something or avert your gaze, but sound. So they were enveloped in this. And the thing they noticed was the next thing is that patients in the waiting room, they were taking their mindful moment as well. So it's almost like they were enveloped in this culture of wellness. I think we need to move towards that in our communities. I think it needs to be introduced K through 12, so that they learn from the get-go that this is part of life. This is the good thing. And so I think that we're not there, but I think we need to move towards that, to where it's just like fish in water. It's just all around them. It's available everywhere. But I think that, going back to what I said earlier, is we really need to take the major players now, the payers, the providers, and pharmacy and so forth. And we have to learn to work in a new and integrated way that makes sense. And if we do that, that's the first step in the journey towards that sort of utopian fish in the water thing.
I love that example because I think it just shows the power of creating space for people. And one of my favorite practices is just breath work. It's a technique called box breathing, where you're doing 5 in breaths, 5 seconds of hold, 5 out breaths, and 5 seconds of hold. And it is the simplest practice, but a lot of times whenever whenever we first start thinking about, okay, how do I'm not a good meditator, or I don't have time, and there becomes this conversation around, if I'm not productive, if I'm not busy all the time, then who am I? And so one of the things that has really come out of this series on self-care for healthcare professionals is prioritizing some of those mindful moments, because many of us are empaths. We take on other people's, and just kind of build up that energetic burden, I guess, throughout the day. So taking four times per day where you're literally just whew, just breathing and just taking a minute. I think as we see chronic stress being one of the biggest drivers for chronic health conditions, having conversations around stress, physical, mental, spiritual, emotional, whatever, is something that I want to encourage people to make normal, and make a normal part of our discussions, especially within healthcare. I think it's helpful for healthcare professionals to hear discussions like this happening around, what does healing mean to you? What does healthcare mean to you? Because many of us have kind of gone on our own health journeys, or gotten off the health track, and getting back to, what does it feel like to take a minute for myself, to just breathe, to just be with myself, to kind of embody what does health and well-being and wellness mean to me. That that role modeling of what a picture of a healthy person looks like, I think we need to focus more on our own healing, so that we can have an impact on that of our patients. So it's not like, do as I say, not as I do, but it's really empowering healthcare practitioners to walk the walk. So James, I just want to thank you for your advocacy within holistic health, within thinking about how we can raise the consciousness of the healthcare profession, so that we can have a bigger impact on health, and get to the true root of healing. So I want to thank you for joining us here today. Is there anything you would like to add, additionally, that we haven't talked about yet?
Oh, well, again, as I said, I've had a sort of rather long career. I'm not even gonna tell you how old I am, but I could have retired quite a while ago. but I don't because I find this interesting. This is what but I've been involved in this for a long time. The first medical school in the United States that offered acupuncture in the curriculum was George Washington University. I was in the first class. So I was sort of spoiled goods by the time I got to medical school because I'd already done degrees in psychology, molecular genetics, and nutrition. So I came in thinking prevention. I go, we got to keep them out of the hospitals. So as I went through the process of a medical education and so on, and did do a lot of clinical medicine, but I'm always thinking in my mind is, no, we've got to move this upstream. And it's just like sort of, I've been waiting all these years to have people to play with. And that's why I'm still involved, is because now is the time and there's people like you and a growing community. So I find it really invigorating and encouraging.
Well, thank you so much for saying that. And what a wonderful testament to the possibilities that are out there when we begin thinking outside of the box. So I talk a lot about entrepreneurship and how entrepreneurs focus on solutions. I think that the solutions lay in the ideas and in the experiences of the healthcare professionals. So really taking our power back for saying this is the direction that we've taken on our own health journey, and here's something that could be helpful for you, whether it's acupuncture or Reiki healing or Tai Chi, energy medicine, really being able to speak to that from a place of experience.
Mm.
I've experienced this and it was beneficial to me. Giving giving patients the opportunity to open up and ask questions that they may not have ever thought to bring to a physician or bring to a pharmacist. It's really encouraging to me to have this platform to begin these discussions. So I'm encouraged. I want to encourage you, if you're watching and wondering how you can begin speaking about the value of whether it's pharmacist services or physician services and what true healing means to you, that we're available. I'd love to be able to chat with people who are looking for a little bit different way of practicing. If you feel like you don't belong in healthcare, I want to encourage you that there is space for you at the table, and that there is a place, and that the paradigm is shifting, and you can be a part of the change that you wish to see in healthcare. So James, thank you so much for joining us here today, and thank you for being a part of the change that you wish to see in healthcare.
I would encourage you to keep doing what you're doing. This is important. So thank you.
Thank you. All right. Okay.
So hopefully that wasn't too awful.
Oh, hang on just a second. My screen froze. No, I thought it was great. Oh, are you there?
I'm here.
You're here? Okay. I'm frozen.
Not to me, you're not.
That's so weird. Okay. So yeah, I think that this oh, there we go.